So this is Dr. David Cosio, and he is a board certified health psychologist, and he's been at Jesse Brown now for over a decade.
Yep.
Yeah, and he single-handedly has created the pain school and developed the pain program at Jesse Brown. So over the next 25 minutes, we're going to be talking about pain management, and whatever else Dr. Cosio wants to talk about. So please, if you have any questions, now is your time. For the next 25 minutes, you can call 312-738-1060. So Dr. Cosio, thank you again for coming on the show. I can't believe it's been that long.
I know, I couldn't believe it either when I started looking back. It's been 10 years, but I'm glad to be back. And like Eric said, there's a lot of stuff that I want to share with you guys about what we offer in the VA for pain management.
Yes.
Yep.
One of the things I want to, I noticed that you got a book.
Yeah.
You got a book called Pain Relief, and it's been out since last summer.
Yep.
Yeah. And it's managing chronic pain through traditional, holistic, and Eastern practices.
Yep.
So why don't we first start off? Tell me a little bit about the book. How did it come about, and what can our viewers expect to get from it?
So, I worked in the VA for the past 10 years, and I learned a lot working there about pain management and the different types of resources that are available to our veterans for pain management. The thing is that I also kind of consult with people in the private sector, and what was really interesting to find out was that a lot of people in the private sector are either not even aware of all these different types of treatment that are available or don't have access to them. And so one of the things that I wanted to do was take everything that I learned and put it in one place. That way people had that information available to them, regardless if they were in the private sector or if they were a veteran. And so that's where the development of the book came from. So it's a labor of 10 years of education that I got from working at the VA.
That's great. That's great. And so that's one of the things that I was hoping you could expound upon, because you've been at Jesse Brown VA Medical Center for over a decade now, and you've been doing some work in the civilian sector. How would you compare what the civilian sector has to offer for pain management relative to what the VA is doing?
So, the traditional treatments like, medications and injections and physical therapy, you can find those in the private sector. But when it comes to the mind-body treatments and the complementary and integrative health modalities that we offer in the VA, those are oftentimes not accessible and not even available to people through their insurance companies. And so one of the things that, we have at the VA is the ability for veterans to have an acupuncture appointment. We have an acupuncturist in the VA. We have a healing touch therapist in the VA. We do Tai Chi, we do yoga, as you know.
That's right.
And so those are things that really help with pain management that people in the private sector may not have access to or have to pay out of pocket for.
Yes.
And so again, providers in the private sector will usually use traditional treatments and kind of forget about these other treatments that have been shown to be just as effective when it comes to pain management. And we're lucky at the VA that we have those.
Mm-hmm.
Yeah.
So why don't we talk a little bit about what Jesse Brown VA Medical Center has to offer in terms of pain? And,
Yeah.
So say I'm new to the VA, maybe I'm a post 9/11 veteran. Number one complaint is pain among those veterans due to difficult deployments and the skeletal injuries. And I make a complaint to my primary care provider.
Mm-hmm.
What happens at that point?
So, the first thing is what we're seeing with a lot of our returning veterans is not only that they have this musculoskeletal pain, but they also come in with traumatic brain injuries, and they come in with untreated, undiagnosed mental health conditions, and sometimes, unfortunately, with substance use. That's kind of what occurs. And these things kind of occur together. And so what's really great is that when you're evaluated by your primary care provider, we can start kind of of piecing those pieces together and realizing that they may have a relationship. If you're with your primary care provider and you're sitting here and you're saying, that sounds like me, that sounds like some of the things that I'm working or dealing with, go to your primary care provider and say, do you think that it would be good for me to have a consultation with the pain clinic? Now, the pain clinic at the Jesse Brown is pretty interesting. I've been there for 10 years, so we've been together for a long time. What we offer is a multidisciplinary approach to pain management. So not only do we offer the traditional treatments like the injections, the medications, and the physical therapy, but we also offer things like spinal manipulation. We have an osteopath in our clinic who also is an expert in functional medicine. I work in the clinic and I offer traditional psychotherapies that have been shown to be effective for chronic pain. So things like cognitive behavioral therapy and acceptance and commitment therapy, biofeedback and hypnosis. Those are things that we can offer in the pain clinic. And then we also have a pharmacist who can meet with patients and talk about medications and if they're having any side effects or complications, about ways in which they can improve on that. And so as a team...
So that is truly an interdisciplinary enterprise.
Yes.
It sounds like many different pieces of the puzzle, because it sounds like that pain is a complex, messy thing that must be disentangled and approached in a complex way.
What oftentimes really throws people off is when they come into the pain clinic and they see a psychologist, and then one of the first questions I get is why a psychologist? Why is there a psychologist here? And so it's really an opportunity to talk about the mind-body relationship and how, the brain is really not able to distinguish with it between physical and emotional pain. It just registers pain. And so somebody could be coming in with a physical injury, but we also have to be mindful of any psychological, hurt that they are experiencing and addressing that in combination with some of the other things that we're doing.
Yeah. And so what can a veteran expect at Jesse Brown in terms of their length of treatment and expectations around pain management, being, pain-free versus, a chronic dependence on an opiate medication for...
Yeah. So, when a patient starts in the pain clinic, one of the things that we do now is we do an orientation to the clinic. And why we do that is because, patients sometimes aren't given information about what to expect, or, they come in and they're expecting one thing and then it ends up being another. And so we want to make sure that people are getting the correct information. So in that orientation, what we talk about, is the difference between acute and chronic pain. So, acute pain is when you first get hurt up to 3 to 6 months, and anything beyond 3 to 6 months is considered chronic pain. Now, when you have a chronic pain condition, that is usually when people are referred to the pain clinic. And the reason why is because, as you've said, it's a very complex experience, and we have to look at the biological, the psychological, and the social aspects of the person's life. And so that's why the pain clinic is an important referral, is because we have all those things and we consider all those things in the treatment plan. And so when you come in, we kind of give you an orientation. We explain the expectations that you should have, what to expect when you go to these different appointments, who you'll be working with. You meet the staff, you meet myself, but you also meet the pharmacist and the osteopath. And then you meet with the physician who begins the evaluation.
Great. And so to get to the pain clinic, does it have to be a primary care physician?
It has to be a primary care provider. So for our female veterans, it's their provider who works in the women's clinic, obviously. But for the rest of our veterans, it would be their primary care provider. You would ask them if they believe that a consult to the pain management clinic would be appropriate for their case. Because in most cases, patients who have chronic pain look to their primary care provider for treatment. That is the norm. But in the VA, we have a multidisciplinary team, which is quite unusual, and we're actually one of the ones that are in this area. Well, if you put VISN 12, we are the VISN 12 multidisciplinary team here in Chicago, which is great. And so, it would be good to have, it is important that you have a consult to from your primary care provider. That is the way to do it.
Okay. So, are there any lessons that you've learned over the last 10 years? Any trends that you see that in terms of veterans' preferences of what works, what they like, recognizing that, people are different and different things work for different people.
Sure. So, what I've noticed in working with veterans is they are a microcosm of the general public.
Yeah.
They kind of reflect what we see in the general population. So I think the thing that people mostly want is an easy fix, and unfortunately that doesn't occur. That doesn't exist.
Yeah.
And so a lot of times it's getting people to recognize and realize and accept the fact that there is not a quick fix. I think that's the hardest piece. I think once people get to that point, then they're more willing to kind of learn what else we have available, which is why we created the Pain School, is so that way veterans know about the 28 different treatments that we have available for pain management in the hospital. I mean, we're one of 4 hospitals in the country that can say that have that many treatments.
One
that are
of 4
available.
hospitals in the country. That's amazing.
So, we want patients to, when you go to a primary care provider, when you go to your doctor, usually what will happen is that the doctor will say, this is your treatment plan. This is what you're going to do. And we don't feel like we really have a lot of say. And what we try to do with everyone that comes in is that we offer an assortment of different treatments that are available. Again, that there's no research to show that one is that much better than the other. And so it's really patient choice. And so if they would like to go the psychological route and do some of the psychological options, they can do that. Or if they want to do the traditional route, but they are offered an assortment. And the way that to learn about that is to go through our pain education school. And again, if you're interested in doing the pain education school, you could do that by asking your primary care provider to put a consult in for that as well.
Okay, great. Well, it looks like we have a caller. And for those of you that might have just joined us, I have Dr. Cosio, who is a pain expert, a board certified diplomat in health psychology, and he has developed the Pain School and is a pivotal member of the Pain Clinic at Jesse Brown VA. So, hi caller, this is Veterans Issues. What is your question?
Hello, my name's Steve in Chicago.
Chicago? Hi Steve, I'm sorry.
And I recently watched an episode of 60 Minutes where a woman had sickle cell anemia. And she had a problem with her pain, and she was on the higher end of the numeric rating scale, and the healthcare professionals were not believing her. So I was curious if there is some type of a protocol where, things can be free of bias. Do the healthcare professionals have to consult with each other as it relates to the numeric rating scale, which I was reading on Wikipedia says it goes actually 1 to 11.
1 to 11.
So
First, why don't you describe what the numeric
rating scale
is?
So in the pain clinic, the numeric rating scale that we use goes from 0 to 10, 0 being no pain, 10 being the most excruciating pain you've ever had in your entire life, which is considered an emergency, right? And so that's unfortunately the only way we have for us to communicate to each other about what is going on. Now, the misconception that people usually have is that we make decisions based on that scale, and that's not the case. That is a scale to help us understand if you're seeing any benefit or any change after we've done some different types of treatment.
And the scale is subjective, meaning
Right.
like it is the person's perception.
Right.
So that's why it might be difficult when it sounds like you're looking for an objective measure of pain that could be, everyone can agree that this is what the pain is, but all pain is subjective, right?
That's correct. And so it's not comparing you to other people, it's comparing you to yourself at different time periods, right? So if you come in, the first time we meet with you and you give me 1 score, and the next time you come in, we're going to ask you again, and the reason we're asking you is to see if there has been any change or if better or worse. And so that way we can make treatment decisions based on that. But like Dr. Persher was saying, unfortunately, it's not an objective measure, it's subjective.
Caller, did that answer your question?
Absolutely. Thank you very much.
Thank you for calling. So, I And actually, I've heard you talk a little bit about it. I like that you clarify, because sometimes it's helpful to give people anchors,
Right.
about what that means, because
Yeah.
some people are like, oh my God, my pain's 11 out of 10, and like, and I've heard you say something like, well, if it were 11 out of 10, like, we might need to take you to the emergency room right now because
Right.
it would be uncomfortable to sit here and communicate.
Right.
Right.
So I usually give two anchors, because I think you're right. People need something to compare themselves to. So the two anchors that are kind of universal are the average score that women report while during labor. Do you know what number that is?
I have no idea.
The average score, and women will probably be very angry with me, but the average score is an 8. And so if you're coming into the clinic and you're telling me that you're an 8, the presentation would be expected to be close to something that you would see when someone's in labor.
Okay.
Now, the other end of the spectrum is the average score that somebody reports that's just walking around the street.
Yeah.
And so myself, some of the other people that are here in the studio is a 2 or a 3. A 2 or a 3 is pretty normal.
Yeah.
And so when a patient comes in, I think one of the things that we first get to is setting a realistic expectation, is to say, look, we're not here to get you at a 0. Unfortunately, there is no cure once it becomes a chronic condition.
Yeah.
But what we're trying to do is to make you more comfortable, more functional, improve your quality of life, and to get you back out there doing the things that you love. That's what we want to do. And so the goal is not getting you to a 0. The goal is to get you closer between a 2 or a 3.
Yeah. I think that's very helpful, and when I heard that, it made a lot of sense, because 0 is, if you're expecting to be 0, you're probably going to disappoint it, because not many people are at 0,
Right.
especially after a certain age.
Right. and am I saying that you're not going to have a 0 ever? No, I'm not
0
saying
death,
that.
right.
But it's not going to be a consistent 0. It's
Yeah.
not, consistently what we're trying to do is to get you at that lower range, not promising you that it's going to be gone, right?
That's right.
And so this is one of the things that we talk about in pain school. One of the first things that if you come to pain school is that you do an introductory class. And during that introductory class, we talk about, the pain score, pain scale. We talk about pain scores, how to communicate better with your doctor. The number one predictor of whether someone is going to have a better outcome is their communication and their relationship with their doctor.
Wow.
And so if you're not relating to your doctor, if you guys are having difficulty communicating with each other,
Yeah.
that's the problem. We need to address that, right?
So important.
And so-
Communication and expectations.
Right. And so we talk about how to communicate better with your doctor and how to speak their language and how we can better speak your language. And then we kind of give you an outline of why all this is necessary. Why do we have to have a multidisciplinary approach for pain management? Why is that necessary? And so we explain what that is, why we need that, why the research shows that. And then after you complete the first class, we give you a schedule of the remaining 12 classes that cover the 28 different treatments. And why we do that is because we know you guys have other things to do. And so this is a way for you to pick and choose which classes you want to go to. So for example, if they came and they wanted to talk about biofeedback or hypnosis, they would go to that class, they would learn what that is, how that's helpful for their condition, and most importantly, how to get it, right?
Yes.
Through the VA system. And so the 12 classes are outlined for you. You can pick and choose which classes you want to go to. Now we offer these classes here at Jesse Brown, but we do also televise them to Crown Point, Indiana, and Chicago Heights, Illinois. So if any of our veterans are from that area, you can go to those locations and watch the program live through the video conferencing. And get the information that way, as opposed to having to drive every week to Jesse Brown.
Wow.
Yeah.
High tech, high touch, high reach.
Right.
So wow. So is there a favorite modality that has been a surprise to you?
So when we've run research to kind of see what veterans are doing,
Because you've done
right?
some research.
We have
you
done.
evaluated your program.
Yeah. So what we found were veterans are very excited about our chiropractor. We have a chiropractor. Like I said, we have an osteopath who do spinal manipulation.
Yes.
So veterans are more likely to try those modalities out. Again, those may not be as readily available in the private sector, right?
Yeah.
The other interesting thing is that there are modalities that people aren't as excited about.
Okay.
And usually those are the ones that are from the complementary and integrative perspectives. And so it's usually because they lack information about what those are and how they can be helpful for their condition. But once they learn about it, then they start using them.
Great.
Yeah.
Hey, for those of you that have just joined us, I'm here with Dr. Cosio. He's a pain psychologist. I'm Eric Prosher, and we represent Jesse Brown VA Medical Center. So this is your last chance to call in and ask any questions about your pain, about what Jesse Brown has to offer you in regards to pain, or any other questions around medical care. Call us, 312-738-1060. So while we're waiting for callers, I have a segment of the show I call Rapid Fire, and it's kind of like a free association. So
Okay.
I'm going to ask you a bunch of questions, and you just tell me the
First thing that comes to
your
my mind.
Some of these questions might be related to pain, some of them related to your life and you personally.
Okay.
It's just first thing comes on. So, what is your favorite healthy food?
Oh God, salad.
Salad? Okay. What is your worst job you ever had?
My worst job? I've actually been pretty fortunate. I used to be an auto mechanic before I went to graduate school.
No way!
So I would say worse in the sense that it wasn't pleasant, but it was still a good job.
Okay.
Yeah.
Name 3 things that you and your veteran patients have in common.
Well, most of my veterans are male, so and they usually tend to be around my age range, so in the 40 to 50 age range, and they have a lot of honor, and I like to think that I work with honor as well.
Awesome. We'll take a little break because we have a caller. And hello, caller. Thank you for calling. We're here with our pain expert, Dr. David Cosio. What is your question?
Well, I really have a comment, a great comment.
Okay.
Because I had opportunity to go to the pain clinic a good while ago, and I want to tell you that they have such an array of different, like you said, modalities that before you would never think that they would say anything but pain medication.
Right.
And I have talked to different veterans that have used different ones. I have too. You know what I'm saying? And I just want to say they're probably one of the most outstanding programs of pain management probably in the nation.
Yeah? Was it an award-winning program?
Different people that come through there. They actually had some of the practitioners come through there. They allow you to go. Now they have different ones. I was just listening on online right here, listen while watching you, saying some of these people now you have in the hospital, like the chiropractor wasn't there at that time.
Yeah.
Was something about laying on the hands or something, or Reiki,
Healing
or whatever.
touch. Mm-hmm.
Healing touch. That wasn't there at that time.
Yeah.
But I saw it out in the community, and now, it's just amazing. I just think that he's probably been called to come to a lot of different hospitals to set up pain programs like that. Have you had has people called on you to come out to different hospitals to set up their pain programs, Dr. Cosio?
Well, you were saying that Dr. Persher was asking if it's like award-winning. I like to think that we're accredited. So we're accredited through the Commission on Rehabilitative Facilities, which means that we meet the standards for having a rehabilitative program, and we've had that for I think over like 7 years. And you're absolutely correct, ma'am. We've grown in the amount of services that we had in the pain clinic and in the hospital. I think when we first opened the pain school, we may have had 20, and I think in the last couple of years we've added 8 more. So the fact that you're saying some of these things I've never heard of, you're absolutely correct, because we just keep adding. Anytime we find something that's going to be potentially helpful for our veterans, we try to bring that back into the VA.
And ma'am, thank you for your comments.
Because there's a lot of VA hospitals around the nation that could probably use some of your help that don't have pain clinics the way you have them.
Well, the VA is doing a program now where they're trying to open similar programs all throughout the country. But that's a work in progress. But they are working, and they're trying to kind of do the same program throughout the country. So you're absolutely right.
Ma'am, thank you for your comments. We really appreciate that you were impressed with the services at Jesse Brown. We're very lucky to have Dr. Cosio with us, and And my name's Eric Prosher. This is Dr. Cosio. Thank you for coming on. We gotta wrap it up, and so stay tuned. We'll be here next month on the fourth Thursday of the month, and next to Fathers Who Care. So, and if you are in a emergency, need to talk with someone about a psychological crisis, we also have a veterans crisis line, and it's also open to civilians. It's 1-800-273-8255. Talk. Press 1 for veterans. And if you're not a veteran, you just stay on the line and someone will be with you. Also check us out, Facebook and Instagram, VA Chicago, and Twitter at Chicago VAMC. Thank you for having us, and we'll see you next month.